is Archana, Assistant Professor from SNS College of Physiotherapy. So today we are going to discuss on the topic that is Ewing sarcoma. So Ewing sarcoma is nothing but it is a tumor present in our bone. We are going to see in that about what is Ewing sarcoma. So before knowing about Ewing sarcoma, you should know what is malignant tumor as well as what is benign tumor. So benign tumor is nothing but the tumor will not spread to any kind of soft tissue. It will be localized. Malignant tumor is some tumor that is cancerous origin and that will spread to the soft tissue and that will spread to the another body part. It can be spread to the lymphatic vessels or bloodstream. Okay. So this Ewing sarcoma is one kind of tumor that is malignant. So what is malignant? This tumor will be spreading to the soft tissues and to the other body parts in our body. So this is a malignant tumor and it is very highly malignant, meaning it will spread aggressively. So the aggressive nature, this tumor is very aggressive in nature and it is very densely packed. The cells, if you see in the microscopic view, you can see that the cells will be abnormally grown and it will be densely packed and the cells will be very small and round cells. Now if you see the demographic details, it affects mostly the males compared to the females. And the age group, it is affecting particularly the young adults less than 20 years. Okay, so this Ewing sarcoma affects age group less than 20 years and incidence will be decreasing with the age. Now if you see the location of the tumor, mostly this will be affecting any part of your bone or soft tissues and commonly you can see over your pelvis as well as your lower part of your bone. Okay, so in the lower extremity of pelvis is the common location you can get the Ewing sarcoma. Now if you see the causes of etiology, basically all the tumors will be having some radiation exposure and there will be any kind of genetic mutation and there will be any kind of cellular disruption and it can be inherited one. Okay. So here you can see this Ewing sarcoma, it is getting mutated by a gene called as EWSR1 gene. Any mutation happening into the ESWR1 gene, you will get Ewing sarcoma. And if there is any cellular disruption, when the normal cell growth pattern is getting disrupted, it will lead to Ewing sarcoma. Okay. Then it is not inherited. It is not inherited from your body. It is getting from acquired. Because of any kind of radiation exposure and all, you will get the Ewing sarcoma. If you are exposed to radiation or if there is any hormonal imbalance happening also, you can get Ewing sarcoma. Now we are going to see about the clinical features. In this Ewing sarcoma, it is very symptomatic. Compared to osteoma, this osteoma doesn't contain any kind of symptoms like pain and all, but Ewing sarcoma, it has localized symptoms like pain. Okay, so most common symptom is pain and that will gradually increases as the sarcoma develops. And you can see the celling will be growing and it will spread to the other soft tissues surrounding that area. Then you will be having systemic symptoms also. You will get fever and other fatigue, weakness to your body. So you will be having generalized weakness and also will present with fever. Then we see about the laboratory findings. You can see common abnormality you can see is elevated ESR level. Erythrocyte sedimentation rate will be elevated and you can have anemia. Then you can have leukocytosis. Then if you see the metastasis spread, it will be occurring other bones like skull, vertebra, ribs. These are the major locations you can get the spread. From the long bones, it can spread to other areas like ribs, pelvis and to the skulls. Okay, so also it can spread to the lung cell also via your bloodstream. So the metastasis tumor can spread to other area with bloodstream or lymphatic system. Now we are seeing about the pathological characteristics. So you can have microscopic appearance as well as the microscopic features. So if you see in macroscopic view, you can see the tumor will be pale and it bone. So what is osteomyelitis? It is an inflammation or infection that is occurring inside your bone. Now if you see about the radiological diagnosis, the most common radiological diagnosis or the initial modality we use is X-ray, and then you can for the detailed assessment of your bone you can go with CT, and if you need to see any soft tissue involvement you can go with the MRA, and if you need to detect the metastasis, the spread of the infection to the other body part, you can go with bone scan. Okay, so if you see the X-ray findings and all, the most common clinical presentation you can see in the Ewing sarcoma is onion peel appearance. You can see onion peel appearance in X-ray, and that is nothing but it is a periosteal reaction, and what happens is that in the periosteal reaction there will be stimulation, and that will lead to bone formation in concentric layers. There will be new bone formation in concentric layers, and that will look like onion peel. Okay. So if you look in this figure, you can see this is the onion, and you can see these are the peels of your onion. So in the X-ray also, if you see in the periosteal region, the periosteal region is the region that is the outer layer of the bone. There will be reaction happening, and there will be new bone formation, and that bone formation will be like concentric layers. And you can see this is the area where Ewing sarcoma is present, and you can see this area there will be new bone formation. So that is the hallmark sign of your Ewing sarcoma. Then if you see another imaging examples like CT and MRI, you can see the X-ray imaging views that will see the soft tissue involvement of the Ewing sarcoma. So moving on to the treatment. So the most common treatment you can do is chemotherapy, then you can do the surgical resection, then you can do skeletal resection, then you can do post-operative therapy. Okay. Thank you.